really thrilled to be here today. I'm reminiscing about last year, standing in Lake Louise, talking about the launch of this strategy in Alberta. And so it's a privilege to be able to talk about the year in review and celebrate that this wasn't a document. I'll go back to the cafeteria talk where John said to me, you know, I'm not interested in creating a document that's going to sit on a shelf. And so I promised him we would not do that. And so the celebration today around the document was a springboard for launching a series of activities that we'd like to talk to you about today, and actioning pain as a priority for our province and for Albertans. I want to start off with a patient quote. Ryan is one of our patient advisors on the steering committee for the Alberta Pain Strategy, and he's one of many. And he I don't think was able to make it, but as a patient advisor, it's been great to help design the strategy for all Albertans. The steering committee has laid out groundwork to build out a strategic plan, and now the working groups are underway actioning those detailed plans. And so Ryan attends every meeting, has lots to contribute, and reminds us of how important this work is for all Albertans. I want to make sure I give voice there, the celebration. And then there's Ryan, one of our many advisors that's making a contribution. One of the other contributors to the steering committee is Miriam, and her thoughts are that the breadth and depth of knowledge and commitment and compassion of contributions to the strategy, along with the efforts to optimize the daily lives of those living with chronic pain, impresses me immensely. I recently learned that corporations reached out to the Alberta Pain Strategy, lauding the information presented in the quote, "Let's Talk About My Pain" online presentation, which was orchestrated by the Pain Society of Alberta. These companies are encouraging their employees to learn from it, reinforcing my belief that this strategy is important and timely. So today we want to talk about a year in review. I'm going to talk a little bit about the overview, the development, and some of the focus areas and priorities. And Rob will talk a little bit about some of the actions that are underway, some of the working group, and the launch of our Alberta Research Network, which we're quite excited about. So our approach to bringing the strategy to life, first of all, as John had alluded to, we started with a small few, and it grew to many hundreds of people, and it continues to grow to this day. We wanted to build it on the spirit of collaboration and cooperation and take advantage of the strengths that we have here in Alberta. And those are listed there for you. I think it's important to know that we have primary care governance in the province, and that is really helpful in bringing the Alberta Health Services system and the primary care system together in a more meaningful way. We have great analytics, and we're building them all the time. We're in the process of implementing we call it Connect Care, but it is an electronic medical record for the entire province. And when you think about learning health systems, you know, you need a few things. You need evidence-based care. You need really good analytics, and then you need improvement methods to put them into place. And so having strategic clinical networks as engines of innovation to help bring the evidence and bring it into practice, coupled with our Connect Care and Enterprise Data Warehouse, we feel like we have a strategic advantage. We also have significant numbers of patients and families as partners, not only in the work of the pain strategy, but in the work of Alberta's health system. And we've certainly taken advantage of that. And I would be remiss not to mention that we have strong academic partnership, and through that we've been able to work with them to launch the Alberta Pain Research Strategy, which you'll hear a little bit about later. This is a very busy slide. I don't expect you to read it, but it really talks about the SCNs, the Strategic Clinical Networks. And why would I talk about the Strategic Clinical Networks? Well, when we got started on this, and one of the motivations to go talk to John about pain was pain shows up in every clinical encounter, and every SCN was being asked, what are we doing about pain? So it struck us that pain belongs to everyone, but there's no accountability to anyone. So what we decided is we would launch the first Pan SCN initiative, and the Alberta Pain Strategy was adopted as the ownership of all 16 networks seen on this slide. Just our journey, we started in the fall of 2017 with some very initial work that had been underway. We followed up in the winter with an environmental scan. We started looking at some strategic planning steps, and we started to think about a draft strategy. In the spring of 2018, we brought over 100 stakeholders together to start looking at our gaps and our opportunities. And through that meeting, we were able to create a vision for the Alberta Pain Strategy, which is achieving excellence in pain management across the lifespan for all Albertans. We created the focus areas because we knew that if we did not focus, we would not finish. And so our focus areas and priorities were in acute pain, chronic pain, and opioid use and pain management. And I won't read those because you'll see them, but we tried to identify some priority areas within each of those working groups so that we could start to flesh out a plan for the next 5 years. We also thought about governance. So where would this sit? How would we organize ourselves so that we could get work done? And how could we pull upon the many people who have an interest in pain, who work across our health system, and who could see themselves within the work of the strategy? Just last year, we established an advisory committee, and we created a number of working groups. So the steering committee was developed, then the 6 working groups were created. And then in order to get all of the regulatory and professional bodies and others, we have launched an advisory committee and an interdisciplinary access working group. And all this busy slide is to say that the steering committee reports up into the SCN leadership, and we have lots of groups that are working across the system so that we are guaranteed that as we action activities and as we start to move the dial forward, we have a link up into the senior leadership team of Alberta Health Services. With that, I think I'm going to turn it over to Rob, and he's going to start talking about the focus areas.
Thank you so much, Tracy. Just going to pull this up right now. So we're going to talk about the actual action aspect of what we're doing. And I just got to do one thing. There we go. We've moved into several working groups where we're actually taking, as was mentioned really nicely by Tracy, and what many of us have said, building a document to sit on a shelf is useless. Building something that means something to all the people who live with pain every day and all the healthcare practitioners that are trying to help them is much more important. So one of our focus areas in acute pain was perioperative pain management, and really about developing and implementing provincial, evidence-informed, standardized clinical pathways for acute pain management during surgical journey. You heard lots from the pediatric group and some horrific stats about children not getting any sort of pain control for acute pain in either perioperative or procedural medicine. This is the kind of things that we want to standardize so it will simply not happen again, whether children or adults. We have done an environmental scan already, and we've looked at the current state of pain management practices across all of the surgical sites in Alberta. We are working forward to a literature review, looking at surgical pain best practice, and then of course a data analysis of post-surgical discharge opioid prescriptions and patient experience surveys. And as mentioned at the beginning, having people with lived experience as part of our steering committee and part of all the working groups has been pivotal as we've moved forward. And I think you guys get the idea of how important it is for us, both from the Pain Society of Alberta and the Alberta Pain Strategy, and of course, Alberta Health Services. The next one is medication policies in acute pain, really about implementing a return of unused opioid program and examine appropriateness of acute care pharmacological options for pain management. So really putting together simple guidelines. As you heard, codeine is being removed as a treatment for acute and chronic pain. In the pediatric world, we'd like to see that pretty much in all worlds, as quite simply the vast majority cannot break it down and live with more of the toxic effects than anything. In progress at this time, as we've been working with 𝐒𝐂𝐑𝐈𝐁𝐄, we're looking at the codeine rapid review process and the custom in press reference search. This application is moving into stage 2, and this is about developing a provincial model for transitional pain services in the surgical context. It's again about perioperative pain. We do have some pilot programs, including the Calgary South Health Campus, the University of Alberta Hospital, and Alberta Children's Hospital, where our 3 sites will be. And the Calgary South Health Campus has a TPS service up and running. A big shout out to Hans Clark and everything he's done to make these things happen. And seeing the data and the evidence, it's pretty obvious we want to move forward in this area, protecting all of our patients from preoperative, operative, and postoperative pain, and supporting them with the best possible outcomes that we can do. Moving into the chronic pain areas, we're looking at models of care to develop a provincial model of care for chronic pain in Alberta. A lot of this that we've talked about is a hub and spoke model, and you might have seen some hints of that in our tweets of the hub and spoke computer background pictures that we've taken. This is also in progress, again, working with 𝐒𝐂𝐑𝐈𝐁𝐄 in a pan-Canadian environmental scan and literature review on the hub and spoke model. We've completed an environmental scan on chronic pain providers, and we're determining critical components for an Alberta model. Again, simply copying something with our current hospital system and our current clinic system in the outpatient world. And of course, with the models of care, there's some important aspects of primary care and the medical home. And we've been working a lot with the ACFP as one of our steering areas and making sure that primary care is highly involved in this process. Outcome measures, so identifying and implementing a provincial outcome measures for chronic pain. We have completed a literature review to identify domains and tools, and now we'll be doing a modified Delphi process. This will be first to survey. This first survey will be launched in mid-November. We will be including focus groups in our patient advocacy groups so that we understand both on the side of people living with pain and on the side of people treating it to make sure that everybody is involved in the process. This is an extremely exciting process where we will be looking at how we're doing things and is it improving everything. Of course, education is a priority for all focus areas. We will establish a pain education resource. This is a repository for both the public, patients, their families, and providers. This isn't just for healthcare providers, but for everyone to access. We have established a leadership team to work with this group, and we are mapping out a repository as we speak. Collaborations that we have right now, this is the most important thing. Before we go into it, you've heard it over and over and over again. It's starting with a cohort of people with lived experience with chronic pain. And of course, excellent collaborations with the Canadian Pain Task Force, with 𝐒𝐂𝐑𝐈𝐁𝐄, with Pain Australia, with SCIP, and with the University of Alberta PACER program, again, talking about patients. Again, at the end of the day, if it's about us, it's with us. And that is the plan that we continue to move forward with, focusing on those with lived pain. And then working with Cadith on a Cadith rapid response on codeine. So we're looking at codeine, and this is again Cadith's excellent work. And one of our steering members is also a Cadith representative, Genevieve, which is amazing. So looking at opioids for pain relief in pediatrics, you've heard a bit about that already. Acute pain, pediatric pain and acute pain for urological and general surgery patients, and a synopsis of the total evidence with a tool. So stay tuned for that. We also have research. Now, this is what's really important, is it's about acute pain, transitional pain, chronic pain at all areas of one's life cycle, from pediatrics to geriatrics and palliative care, and looking at 5 priority research areas with the incredible researchers that we have in this province. You've heard from some of them, such as Melanie Knoll and Katie Burney, and there are so many fantastic ones here in Alberta in all of our major universities. We'll be looking at opioid use and misuse, pain and chronic diseases, pharmacological and non-pharmacological approaches to pain management, pediatric pain, and the impact of pain on our healthcare system. So we will wait till the end for questions. One thing I'd like to add in there is also looking at the possibility of how a provincial pain model will look. We heard this earlier today, and really looking at how do we incorporate this so that we can make this a sustainable process. The advantage we have is working with and directly interconnected with Alberta's strategic clinical networks. And you can check out the Canadian Journal of Medicine in order to look at all of the publications on the strategic clinical networks. Really quite impressive as how it all works. And from there, we'll take a pause and move to the next group, and happy to answer any questions. And of course, in the networking fair, Tracy and I will be there as well to continue taking questions. Thanks.